back. Good. Relax your arms.
That's the best one right there.
You like that one, huh?
Yeah.
Okay, we're going to go ahead and start laser treatment here on Parker. I was going to go deeper with the laser today, but since we had a little bit of a flare-up over the weekend, we're going to go back to the same frequency. And we're going to go ahead and laser all along the rib head area here. So where all his ribs attach right into the spine, and we're going to go all the way down to each level and laser each level. It takes a while. It takes about 20 minutes. So I'm going to spare you folks some of this in our video. We'll just speed it up here, but we're going to do all along the paraspinal muscles where the rib heads attach here, and then we're going to also do on this side here. Now, which side's more sensitive for you? Yeah, left side. So we're definitely going to focus on his left side. That's the side that's much worse for him. And because we have a couple of lasers, we're going to sandwich a couple of lasers here on his back, and we're able to speed up the treatment times here just using a few other lasers. And Parker, I'm going to have you take one of these lasers home. So you're going to treat again tonight before you go to bed. And then you're going to, so watch, when you turn this rental laser on, it's going to have all these lights on. Then you're going to put it up to the skin and hit the start button again. It's going to test each laser, watch. So you can treat every 6 to 8 hours. So you'll treat again, it's now 4 o'clock. So you have to wait till at least 10. So anytime after 10:30 tonight, you can treat, okay? And then you'll do it in the morning when you wake up. And then in the evening again. Okay, until you leave and go back to back home, which is not California, right? It's Texas. So we had said he's from California. He's originally from California, but lives in Texas. Now, this laser, you'll hold it on each spot for 2.5 to 3 minutes, okay? Do you have somebody that can help you with the back area here? Yeah. Okay. If you want to focus just on one side, focus on the pain, on the costochondritis side, okay? And then in the chest area, I'll show you what we'll do there. Again, 2.5 to 3 minutes with this rental laser. And are you having any rib pain up higher, like up in this area? Yeah, or is it? On the left side. Okay, and are you also having it in the mid breastbone area as well? How about below the nipple?
Not too much below.
Okay, so right at the nipple line and up?
Yeah.
Okay. So this laser right here, this red one you see here, it's actually positioned a little bit lower than where that nipple line is. So the ribs actually slant upwards. So right where this white one is, this particular rib right here wraps around, and it's right at about that nipple line at about the 6th rib. But we're going all around the area here just so we can be thorough and we don't miss anything. And you may actually start to feel the muscles relaxing underneath this laser more and more. And after you leave here, it should be easier for you to take a full deep breath. Then it makes it difficult for you to exert yourself because you can't take a full breath and it hurts too, right? Good. Now this other laser I have over here, the white one, that one I move a little bit more frequently. It's a little bit stronger of a laser. It's a 25 watt. So I'll let Sam know that you're probably going to take one of these tonight for a few days. And she's going to print out, she's going to have a brochure for you and mark the areas, mark the program number that you're going to use, program 3, right? And this laser shuts off after 5 minutes. So it'll do 5 minutes of treatment, shut off automatically. So make sure you have a timer in front of you, like an iPhone or something, a watch, and time it for 2.5 minutes, then move to the next spot, 2.5 minutes. And then it'll shut off and you have to hit this white button again and restart it all over again, okay? Okay. Let's have you turn over on your back. Lay on your back, and I'm going to have you slide your shirt up a little bit for me. Mm-hmm. You could slide up a little more. Up this way, yeah. There you go. And pull your shirt up for me. Starts right there, right? And today we're actually going to adjust his ribs. Not just his spine, but the ribs too. How are you doing out here?
Pretty tender, actually.
Okay.
But
Most of your pain was in here in the center?
oh yeah.
Okay.
But I've been like massaging that pretty much all around.
Okay. You did some of the stretches this morning and yesterday as well?
Yeah, I have a hypervolt at home, so I was
Okay.
doing that.
So he uses a Hypervolt. You can use that or a Theragun. There's a bunch of different companies making them now. You can use that. It's fine to use that along the pec muscle and the pec minor in the chest area. Make sure you don't put it on your shoulder joint itself, like right on your AC joint. That's not smart to do. You could hurt your shoulder pretty badly.
Where's your AC joint?
Right here. A acromioclavicular joint. So you wouldn't want to come from the top of it and do that, okay? You can do it in here and right in there. Just stay away from there.
Yeah.
And that's tight. You feel that right there?
Yeah.
Go ahead, take a deep breath in for me. Is it as painful? Or is it easier yet? A little bit easier already?
A little bit easier, especially with ice.
Okay.
I feel like ice has definitely been helping on the chest.
Yeah, ice
I
on the
never-
chest
I
and
never
heat
did
on the
that
back. Okay.
Yeah, shoulder, that's messed up.
Yeah.
But I had this stuff going on before.
The shoulder injury, yeah. And oftentimes, like, an injury can create problems like costochondritis. Usually it's a cause of some micro traumas prior to the costochondritis that flares it up in the first place.
Yeah.
So now we're going to get underneath here and do the pec minor, okay? So folks, you're watching this laser. It's, again, it's a little boring. So, yeah, we'll speed this process up or fast forward it a little bit. But it just helps to reduce inflammation, break up muscle spasms, and inhibit pain much, much faster than anything else can. So this is going to speed up the healing process for him, and we don't have a lot of time. So that's why we're going to send him home with this red laser here, 15 watts. So you're going to treat for 2.5, no more than 3 minutes per spot, okay? Whereas this one's about 1.5 minutes. And then we have a 50-watt laser. That one's being charged right now, and those treatment times are even less. Okay, and now what I want you to do is cross your arms in front of you. Yeah. Tuck your chin down. Do a half of a sit-up. Take a deep breath in and blow out. Wow, that was a lot of movement from your thoracic spine, and relax your back. Head back, good. Relax your arms.
Best one right there.
You like that one, huh?
Yeah.
Now take a deep breath in. Blow out. Okay. We need to check your shoulder now, so let's have you stand up. And we'll have you face the camera here. We're going to check your clavicle again. Look at that, folks. It's even. That's awesome. It was, if you zoom in there, you'll see that it's perfectly even. So it held. That's a really, really, really good sign. Because if it didn't hold, that could mean there's a separation. And we have to tape it down, and that takes 8 to 10 weeks for the sharpies of fiber to reconnect and for that to heal. So that's a really good sign that that didn't come out. You're all set for today. I'll see you tomorrow, okay?
Cool.